diabetes management, the challenges. It's always a big challenge because the sarcopenia has got a lot of, studies says that it has got a lot of relationship between the insulin resistance and the skeletal muscle is considered as the insulin, the major role in having the insulin-related glucose metabolism. In that topic, we have an excellent speaker from a close friend, Dr.Suresh Damodharan from Coimbatore. He's a MRCP fellow and he is a specialist in endocrinology from UK. Currently, he is the Vice President of Endocrine Society of India and he is the Organizing Secretary of the TECON, the International Diabetes and Endocrine Conference. He has got a lot of publications, national and international journals, and I think his area of interest is the sarcopenia. And over to Dr. Suresh.
Good morning everyone, and thank you very much for the opportunity. I think there was a small mistake there. I think I just completed my term of Vice President and it's an immediate and past. So in a way that I think in the endocrine world, muscle is being highly spoken about, and we know muscle is an organ by itself. So we talk about liver, kidney and other organ, but muscle itself an organ. And what happens to muscle when the slow death of the muscle protein happens and the thing with the whole metabolic thing. So it is on a muscle loss, and what it is it's a progressive generalized muscle disorder and accelerated muscle loss. I mean, it has got its own challenges in terms of a lot of functional decline and fragility and motility. Now, this cartoon will tell you about the mitochondrial dysfunction, hormonal changes, chronic inflammation. Can you see? I mean, you think it's a muscle, just a bit of muscle loss, but can you see how much function it's been doing? And when we can't explain a lot of things, muscle is the area we have to think about. And I would say there is no age for doing a muscle building up. So decrease satellite function, and then it will, all other lifestyles of our swiggies and obesities and inactivity, aging, all that will lead to a sarcopenia, and that will lead to the challenges what I mentioned earlier. So I'll put you in a case scenario. It's a 72-year-old with past 30 years, left femoral neck fracture, underwent surgery, and this is a typical scenario, isn't it? So you see elderly chap lying down with this thing, and our parents probably, there are a lot of people you know and I know will have a challenge of lying down in the bed. In that case, the muscle loss is in the rehab hospital, we have to say that physiotherapy is going to be the key. So the muscle was a bit of this thing with 61 kgs, and what could be the action plan. So how do you classify sarcopenia? So the factors that causes is the physical inactivity that I mentioned about the case scenario, and the disease bed rest, and then the poor nutrition, of course, and then you got a systemic illness. I don't know whether you dealt with a lot of hormonal conditions or even a systemic illness like ulcerative colitis or Crohn's disease and other neurological conditions typically. So this is the way to diagnose it. It's a very unique way to do it. Just find the cases and have a clinical suspicion, and you check for the muscle strength. And I think it will evolve in our clinics in few years or so. But with AI coming in, there are a lot of things will be checked, and then the data will be entered in. So muscle strength, grip strength, and chair stand stress, and then sarcopenia you can do with the DEXA bone scan and MRI and other things. So you can confirm with a lot of other factors. That is probably all in the research setting, if you know what I'm saying. In that case, it will be a severe sarcopenia. So this is the 3 key interventions you can do. So exercise is a no-brainer. It is definitely no-brainer to do exercise, but the key thing is the muscle strengthening exercise. You can say, do I need to go to gym? No, you don't need to. I think you can do just a YouTube and get a muscle strengthening exercise at home. The nutritional intervention and the pharmacological this thing. So cognitive stimulation, avoiding hypoglycemia, and then falling prevention. So can exercise prevention? That's the biggest question. We've got evidence for it. So let's look at some evidence, and I'm just going to talk about the meta-analysis of RCTs that is conducted. I mean, you see there is not much of money or any drug companies in it, so it will be done with a lot of funding from this thing. So if you look at it, the appendicular skeletal volume, and then grip strength, the normal gait, all in the, if you see in the right hand side, it is clinically significant, statistically significant. So exercise can be a definitive effective one, and the above results undergoing exercise for more than 3 months, and then sarcopenia, these kind of patients are definitely recommended. That increases the muscle mass and also the strength and the gait, and then the gait speed all went up by doing that. So lifestyle is going to be the key. It is, I mentioned about the exercise, but other things what we do, it is very, very, very important. And the nutritional intervention for sarcopenia, what the studies say, again I'm going to present the meta-analysis of the RCTs, the nutritional intervention to treat sarcopenia. Again, the knee extension strength, and then knee extension strength after 3 months, you can again see in the right hand side, it is statistically significant with after 3 months with the intervention group. So that tells you definitely nutrition also plays a role. So nutrition intervention, for example, it's extending for 3 months. It will intake of essential amino acids. A lot of dietitians probably here. We know that there are a lot of questions that comes from the patient. What sort of diet should we do? But I think if you concentrate in the muscle thing, which will lead to a lot of less trouble. Improving the knee extension, and this is evidence is definitely there. The evidence of ability to treat with the long term is not, however, very clear. So I mentioned about the exercise, I mentioned about the nutrition. Now coming to the drugs, whether drugs can be effective, and again I'm talking about the meta-analysis of RCTs that has been done. You can see after 6 months of the stair climbing, bilateral leg press, lean body mass, I'll show you the drug can be effective, but based on the background, the evidence level is, the older patient is definitely in the lower side. So there's no as such, okay, you're going to give this drug and it will be very effective. But there are some drugs you can play when there is a severe sarcopenia. Key drugs will be a growth hormone analog or a growth hormone secretagogue. However, definitely it will be better if you discuss with your endocrinologist, because they will have a better idea about the hormones and then the anabolic steroids. One of my cardiothoracic surgeon, he uses decadurabolin just for 1 or 2 injections just to keep the muscle strength, but I think the evidence is not that much available, but we can definitely consider if it is a very bad sarcopenia. So selective androgen receptor modulators and myostatin inhibitors. So growth hormone secretagogues, what are the evidence? It definitely, we know from using in the GH deficiency patients like panhypopate and other patients who's got a pituitary tumor or any other pathology in the pituitary where the growth hormone is deficient, or even the birth midline defect, growth hormone defect. If you supply the growth hormone, the muscle strength improves the lean body mass. So androgen, how about the androgen? Androgen can be used, but I think you really need to, it is a weapon. When you want to use the weapon, you have to know the weapon's effect and the side effect of the weapon. So you really need to consider this thing. I normally tend to do a hemoglobin and a prostate specific antigen just to see whether there is anything in the background. That's when I do the androgen replacement. So, but it has got its own limitations. Male breast cancer, and then the weight gain will be there, and the water retention, and people with quite big, and other guys who's got sleep apnea or Pickwick syndrome, it will get worse. So you have to be very, very careful. And these are the things that you should monitor: liver function test, prostate specific antigen, as I mentioned, because androgen will, however, will increase the prostate volume. So we should be very careful about it. So potential side effects are there. As I mentioned, when you use a drug, you have to know the side effects because of the conversion into hyperaromatization. The gynecomastia will be there with androgen converting into estrogen, and then acne and oil skin, and you can get all the side effect of a man who's got some androgen. So it is absolute contraindication in some situation. As I mentioned, the sleep apnea is one of the key things, but other things like cancers of the breast, prostate, and primary liver tumor is no go, definitely not. and when we should consider, as I mentioned about the hematocrit, when the hemoglobin goes up and going into the territory of polycythemia, you have to consider the rise of PSA indicating prostate hypertrophy. So that leads to very quickly to the case scenario 2, 20 years of 70-year-old man with sarcopenia, post-operative complication of cholangiocarcinoma and bedridden, and I think the general condition with improved with the 6 months intervention of nutrition. As I mentioned, a lot of dietitians are here, but they play a key role in improving this condition. But exercise and pharmacotherapy with physiotherapies, and also it's a teamwork. So you can't just do a prescription as a doctor. It has to be a teamwork. And this is to indicate again the usage of the sarcopenia with drugs. And when you do analysis of the muscle, there are some ways that you can analyze. And I mentioned about SAM, it is really not that much commonly used, but you have to know about it. And also myostatin inhibitors, which also it's in the evaluation. That's a Davakurkumab. It's all MAPS evaluation of the muscle functioning and ongoing. It's all MAP drugs, and the bio drugs are all mostly from US. So there are quite a few drugs in the pipeline, but I think we will, people considering sarcopenia as a disease, the days should come before going into all these drugs. So can combined treatment of what I mentioned so far can be effective? Answer is probably yes, and you can see in the right hand side the statistically significant benefit in 3 months duration. So compared to the singular intervention, combined intervention of the diet, as I mentioned, nutrition wise, and then the exercise of the muscle strengthening exercises, resistant training, and also in rare cases you can use drugs. Exercise and medication, as I mentioned, and the exercise wise, quite a lot of things that you could do. These are the drugs again. With the anti-diabetic prescription, you have to use the drugs appropriately as well when you have a sarcopenia as a big challenge. This is the last case scenario, 60-year-old loss of muscle, and type 2 chronic smoker and unable to walk 6 seconds. So the answer is going to be vitamin D, combination of exercise and also to consume protein. But I think the future is going to be very key that the nutrition has changed to not to the days of you're saying high protein and low carb diet. It is not the way anymore, with the precision nutrition for an individual has come. So through artificial intelligence, with precision nutrition for a single individual has come, with your assessing your body's composition and also your sleep pattern. And if one person have an idli and the other person have an idli, that the blood sugar will be variable, you know that very well. So it is going towards precision nutrition. So when you concentrate the muscle as well, we have to be very specific for the muscle nutrition along with muscle strengthening exercises, and the combined effect will do the trick. I'll stop there. Thank you very much. And I invite you for the conference, my conference DECON, which happens in 9th to 11th of August. That's in Coimbatore. Please do visit.